joined by Dr. Kendra Parody from St. Joseph Healthcare. Thank you for being with us today.
Thank you for having me.
So it is National Cervical Cancer Screening Awareness Month, and it may sound a little clunky, but this is a cancer that has few outward symptoms, and thousands of people are diagnosed every year. So this is one of those ones where screening really is the front line of prevention.
It really is.
Yeah.
Over 11,000 people every year. And screening we've had since around 1960 has reduced the cervical cancer deaths in the United States by 70%.
That's huge.
It is. It's a miraculous screening. And identifying abnormalities sooner can lead to treatments that will prevent the progression to full-blown cervical cancer. So hugely important for women to do.
Is this one that's challenging to treat? I mean, all cancer is challenging, but
it's not a pleasant set of treatments to go through.
Yeah.
So identifying, smaller abnormalities sooner is really important.
And so talk about the screening. This is something that, I love the notes say people with cervixes, yes, should do this. Depending on where you are age-wise, sort of dictates when you need the screening or when you should get it. Yeah.
So it's all based on studies looking at the prevalence of cancer in different age groups. Really starting at age 21 is when we recommend starting cervical cancer screening for people. And every 3 to 5 years, up till age 30, it's every 3 years. After age 30, every 5 if you do it with HPV testing. And we typically stop around age 65 if you've had normal PAPs before then.
And so another important preventative measure, beside the screening, is HPV is kind of the root cause of cervical cancer, and so there is a vaccine that's effective.
So HPV vaccine has reduced the cervical cancer rates by about 70% since we've started using it. We have increased the number of people that have access to it. We now can give it to people up to age 45. And HPV is incredibly common. About 40% of U.S. adults will have HPV at some point in their life.
Right.
So really important to get that vaccine to protect yourself and your partners from a virus that is incredibly common.
Do you think there's any stigma attached to the vaccine?
Yeah, absolutely. I mean, this is a sexually transmitted illness. And so there is a stigma with that. But most people at some point in their life will be sexually active, and you have a risk of exposure when you become sexually active. So we really want you to get the vaccine before that ever happens.
Absolutely. And in terms of the vaccine, you said folks up to 45 now can get that. And starting at what age?
Age 9.
Age 9.
Yeah.
Okay.
So it can be part of the routine preventative vaccines you're getting your child with their well child checks, or when you go to see your primary care physician for your pap smear, you can talk about the HPV vaccine with them then.
Yeah, that's an important conversation to have, and probably the earlier the better as far as, parents speaking to their kids.
Absolutely, very important.
All right. Anything else we should know about Cervical Cancer Screening Awareness Month and what St. Joe's is doing to highlight it?
We have over 34 primary care providers that do cervical cancer screenings for their patients. So you don't need to see a gynecologist for this procedure. Very simple, done in the office, only takes a minute or so. And if you haven't had one in the last 3 to 5 years, you should call your primary care provider to get one scheduled.
All right. Well, thank you. It's a very important topic to highlight. We appreciate you coming in and doing so.
Thank you for having me.
All right. And our extended forecast is coming right up.